We're really excited for this next panel. As we were discussing the social and structural determinants frame, and as we think about the structural reasons behind climate injustice, and I really love the way Dr. Pinsky framed it. When we think about climate change, it deeply is an issue of injustice. We really wanted to do a panel where we are talking with organizations working within Frontline, representing Frontline communities. We know that the history of medicine has been one fraught with structural racism. And so how do we use our positions of privilege and positions where at times we've abused our power in a situation we're trying to redress those historic injustices. So I'm very grateful to have as our moderator Dr. Julian Watkins. He's an internal medicine physician and assistant commissioner of the New York City Department of Health and Mental Hygiene's Bureau of Health Equity and Capacity Building. He's also graduated from our Climate Health and Equity Fellowship in 2023. He will be joined by Dana Johnson, who serves as a Senior Director of Strategy and Federal Policy at We Act for Environmental Justice, and Camilo Mejía, who is the Director of Policy and Advocacy for Catalyst Miami. Please join us in welcoming them.
Thank you. I hope you can all hear me okay. My sound good? Yeah. So thank you for coming and listening to our panel today. We'll be talking about collaborating with frontline communities for climate action. And when I was invited to moderate the panel, I was instantly, I went to think, how do I even define community? How do I define it for myself? How do I define the communities that I'm working in? How do I define the communities that I serve? And I would invite everyone in the room today to really think about how they define community. To think about how the communities from which you come, think about the shoulders that you stand on, to think about the legacies that have brought you here to this moment in time. Think about the folks who may have inspired you to get into medicine, to get into this, this sacred work of the healing arts. And then I invite us all to really think about the communities, that we serve. Who are these communities? Who are these so-called marginalized communities? And think about the training that we have as we become these doctors, become these technicians, become these specialists, to think about what is often lost in that training when we think about, being the most objective, and how that is so privileged, and how we think about that's the ultimate goal. And to consider what we lose when we lose that connection, but what we stand to gain when we look at communities, when we listen to communities, when we enter communities with an open heart and mind, and when we think about what we can actually learn from communities, that we are not the only ones who possess knowledge, that we may walk into the room, we may walk into a church, walk into an event and actually walk out changed. We may learn something from folks who they may not have the credentials that we've been taught or sensitized to recognize, but how do we find those other qualities? And so I hope that our discussion today, that we can elicit some of that out, and I'm really excited to share, to join in community and conversation with Dana and Camilo. So I will invite our first presenter up, and I think it will be Dana Johnson, the Senior Director of Strategy and Federal Policy at We Act for Environmental Justice.
Should I take this off? Should I mic off?
Are you planning on walking around with it?
No. Okay. I just wanted to make sure it wasn't interference. Okay, awesome. All right, so thank you very much for having me here today. I'm looking forward to the conversation that we'll engage in, and I can be a little long-winded, so let me just make sure I got my timer set here. All right. At We Act for Environmental Justice, our mission is to ensure that people living in a community of color or an area of low income have a really robust seat at decision-making tables when it comes to environmental health and public health policies in our communities. And I wanted to open up my remarks with a little bit of a story. And this may be information that you all already have, so apologies if it's what you know. So 2015, the Obama administration released what's known as the Clean Power Plan. And very simply, that Clean Power Plan was designed to reduce carbon emissions from the power sector as a way for us to address the climate crises and meet the nationally determined contributions that we committed to as part of the Paris Agreement. It was designed to really go into effect in 2022, and by 2030 be really robust, fully deployed across this nation. But as you know, it faced a lawsuit from the fossil fuel industry that the Supreme Court decided last summer, which said that the EPA doesn't have the authority to work to address the climate crises by reducing carbon emissions. And so it left the EPA in a very vulnerable place because it was now having to come up with a way to reduce emissions that didn't look like it was addressing the climate crises while it was trying to address the climate crises. And at the same time, philanthropy had invested across congressional action, so policy action, a little over, I believe it was like $70+ million to come up with policies and practices, which I consider EPA's regulatory action to be, to address the climate crisis. So there was a lot of money on the line. And last summer, I got invited to a meeting that was bringing philanthropy together. It was bringing environmental groups together, policy experts. There were researchers, scientists going to be in the room. And the purpose of the conversation was to set the stage for additional money to get the EPA's carbon rule proposal under the Clean Air Act across the finish line. How could we really push them hard? What additional science did we need? And in this room, it's a coalition that we're a part of. And I am the only representative of the environmental justice community in the room. So I decided, I gotta get my people lined up. So I know a couple of people in philanthropy, and I'm like, look, I really need you all to back me up in this room. This rule is based off of a premise of harm. We convene a network of environmental justice orgs. It's about 13 of them. They're called Clean Air for the Long Haul Cohort. They focus on the power sector and transportation, medium and heavy duty transportation rules. And this coalition is designed to ensure that EJ voices are inserted in this process. And I was told by philanthropy, we'll do what we can to make sure your voice is heard, but no one is gonna give you money. No one is going to let you stand in the way of money being invested in stopping or opposing this rule. And I got it. So we had a couple of national environmental groups that seemed to have a position that was a little bit closer to us. And I asked them to back me up. And we all agreed they're gonna back me up. We get in the room, and the EPA's proposal wasn't the best thing since sliced bread, but it just needed a little butter based off of what people were saying. And at the end of the meeting, we had a national group that had their research person present all of this data that showed what these emission reductions would be, how we would shut down coal plants, how we would shut down existing gas, how we would improve conditions on the ground in communities. And raise my hand like, hey, what does this look like regionally? What does this look like in the hot spots of this country? I know you can't take it all the way down to states, but how close can you get to where we know the epicenter of fossil fuel infrastructure is in this country? We ran out of money. We don't have time to do that. We can do it in the future. That's a recurring theme. So the second philanthropy financed researcher got up, and he was modeling carbon capture and sequestration and hydrogen, which are the premise of this EPA rule. And at the end of his remarks, he said, but CCS isn't tested. We don't know if it works. And people in the room laughed. And that still makes me emotional today. The best that I could do in that room was cry and say, but it's based off of a premise of harm. and you all are laughing. You are laughing. It's the thing that we have been saying to you as frontline communities for more than a year. This isn't tested, it's not vetted. Our government has invested billions of dollars in it. Our EPA, who is supposed to reduce risk of harm, has put out a proposal that's harming communities, and you think it's funny? So I go back to when you're thinking about the work that you do, the precautionary principles, which I think were developed in the 1990s, that say we got to take action to prevent harm, even when it means we don't move forward. We got to explore alternatives, even the alternative of no. We got to consider the full cost of what we're proposing and what we're asking communities to accept. We got to increase public participation. We say you got to engage us early, you got to engage us often. It's a pain in the butt, but it's what you have to do when you value people's humanity. And if I were to offer what allyship does not look like, it does not look like ramping up investment in an outcome that you and I both know will not work. It does not include discrediting the expertise of the community if it's different from yours. Again, early and often engagement is vitally important, and you have to consider guardrails, even no. Thank you.
Good afternoon, everyone. It's a pleasure to be here. Thank you for putting together this event. My name is Camilo Mejía. I'm the Director of Policy and Advocacy at Catalyst Miami, and we are basically a local nonprofit organization working with local communities to help them meet their immediate needs and also build a better future together. That sounds very cute, I know, but what does that mean? Well, before I answer that question, I'll say that we take a very popular education approach to basically everything that we do. And we're also a very multifaceted organization in that, unlike other partner organizations that we work with, we don't stick to one specific lane, but we do, different things that tend to be, a whole area of work for our partner organizations. For instance, service providers tend to be only service providers. Leadership development, popular education tend to stick to that. Policy and advocacy tend to be researchers and people who are going to go meet with legislators. We do a little bit of all of that. And the popular education approach means that basically we don't come into a space to empower anyone or to teach anything to anyone, but to learn together collectively. I'll give you one example. We have a climate equity leadership development program. And when we first launched the program, my colleague, who's now my CEO, and I were basically facilitating the first cohort, and we were heading right into hurricane season. And so we started discussing the county's preparedness plan, and people started laughing and making fun of it. And the reason they were laughing is because it was completely out of touch with their reality, right? And so some of the points were about, well, you need to have $100 per person, in case that, ATMs go down. Well, we don't have $100, period, let alone per person. Or you need to stack up on water, you need to get this much water and this much food per person and whatnot. And there were people in our cohort who lived in a transit desert and a food desert. And also, we're responsible for 5 or 6 kids, which means going to the supermarket, taking 2 buses to the supermarket times 7, and then coming back with all those groceries and water and whatnot, absolutely impossible, right? And so it's not that we were teaching them how to get ready. They were teaching us how the community gets ready, right? And that's a principle that we carry into pretty much every area of work at Catalyst Miami. So what are some of the things that we do? Well, we believe that the work of nonprofits needs to include both working with the existing system and making reforms to it to make it better for people, but also creating new systems and creating new paradigms and new ways to approach safety, democracy, food security, economic growth, and things like that. And so to give you an example of that, we don't only help people save money or better budget their finances, but also, we offer programs that create wealth. So for instance, we help people with, if they're interested in learning about, having their own co-op and being owners of their own business. Or if people are interested in collectively owning real estate, commercial real estate, so that community members can own the building, where you have the different vendors and then they can hire locally. And this could be an amazing way to build equity and build wealth generationally for people who are basically completely locked out of that, that opportunity. In terms of how we work with health professionals, I was incredibly pleasantly surprised to see Dr. Cheryl Holder here. And I'm sorry, I'm going to put you on blast, Dr. Holder. But I mean, it could have happened better. But the last time I saw you, it was in a trailer in Homestead, which is at the southern end of the county, which also happens to be the southern tip of the United States. And that's an agricultural area. We have a lot of farm workers there, mostly Spanish-speaking farm workers. So I was there helping with interpretation. And lo and behold, Dr. Cheryl Holder appeared, and she was basically there training the students and supervising and making sure that they understood the impact of heat on the community. We have a lot of heat-related illness, heat strokes, things like that. And so basically she was there, in the heat with the farm workers, doing the work, not just, at the school or with the politicians, but also in there with the farm workers, making sure that the interns knew what they were doing, and that, so, that's, to me, that epitomizes the type of work that medical professionals should be doing in the community, because it's not just about understanding the actual illness or understanding the actual impact of heat on a particular community, but also understanding how that community lives. Being bitten by the same mosquitoes, drinking the same water, being out there in the heat with them. And I just wanted to elevate that, because you are one of our, foremost champions in Miami-Dade County, and we love you and we love working with you. And every medical doctor should be like you. So what are some of the best ways to show up in community? I mean, I think that unfortunately, a lot of institutions, nonprofits, government agencies and whatnot have a pretty awful record of showing up in community and not really delivering, and then leaving without, delivering the promise. So I think that one really, really good way is to mean it, and to mean it for the long haul. And if not, then don't, because then you're just going to exacerbate the trauma, and you're going to exacerbate the distrust, and that's just going to make things worse. And so I'd say, like some of the things that we do, whenever we go work in a new community, we look for the leaders in that community. We spend time in that community. We learn from the community about what the issues they're facing are, and we bring community together again so that we can collectively figure out what the solutions are. Because what happens oftentimes that when you don't have community members in the room, you could be the best meaning professional, healthcare professional, politician, whatever the case may be. But if the people who are going to be at the receiving end of that program or that policy or that initiative are not there, guess what? You're going to miss all the good stuff. You're not going to be able to address the issues. And I was listening to the presentation on heat, and somebody mentioned something about air conditioning and installing air conditioning units. We actually had that very same example in Miami-Dade County, where there was a study made, and they said, well, a lot of these residents who live in public housing or affordable housing, government housing, don't have AC units. So let's go install AC units. Guess what? No, that didn't work, because we pay on average about 13% higher than the national average on electricity. And that is even worse in low-income communities because of improper weatherization, because of leaky windows and door thresholds and rooftops and ceilings and things like that. Also, there's hardly any canopy. I know that they mentioned canopy, so there's not a whole lot of oxygen and natural ways for people to cool. So that was not really a great first step. It's a great step once you install the solar panels, you do community solar, you launch weatherization programs, and then you troubleshoot them because they're never perfect at the beginning. So you go back to engage community members about how that's working, what's not working, how can we improve it, and then you work on the canopy, and then you plant the trees, and then you create shade, and then you work with the infrastructure, and then you create the nice, beautiful, shady bus station and whatnot. And so that's how you start, troubleshooting those issues. But if you don't have the people who are going to be standing in the sun, waiting for that bus that never seems to get there, with 3 or 4 or 5 kids, and has, more, not enough money to pay for the electric bill, or having to choose between medicine and the electric bill. We have a lot of people on fixed income in this situation. Having them in the space every step of the way, in the design phase, in the implementation phase, as you troubleshoot, as you do the outreach, as you come together to figure out how you're going to solve this issue, then you're going to end up with policies, programs, and initiatives that look great on paper, but are very ineffective, and in many cases actually make things worse. And so going to the community to meet with the people who are there, who live there, who have been there, who have a proven track record of helping and supporting community members every step of the way. And we're looking at lifelong institutions. We're looking at faith-based institutions who are there from the moment that you're born until the moment you die, literally. School system, working with the school teachers, with PTAs. It means working with community leaders, who are institutions in and of themselves. And then trying to understand the issues and then working in ways that are sustainable and in ways that, it's not going to be about the grant that you got for 2 years and then you're going to do great work for 2 years and then you're gone. So, being in the community in that way, working with community people, and I hate to say community people because we're all community people, right? We all come from some community, right? But Massachusetts, maybe Florida, whatever the case may be, but frontline communities, and being there, like meaningfully being there, and making an effort to learn from the community, not just showing up to teach something, but to learn something and to create knowledge together. And I think that's the way to go. I think I'm going to leave it at that because that's 10 minutes and we have a dialogue, right? And I can just keep going and going and going. But thank you for listening to me, and I hope you have some questions, and thank you again for having me here. And thank you, shareholder, for being you.
Thank you. So now I think we have a lot of time, a good amount of time, to have a little bit of a discussion. And something that has come up in our pre-conversation and even today is this concept of allyship. But in our pre-conversation, I was thinking about what is needed for us as medical professionals who are coming at communities, not in a vacuum, not in a historical context, but actually in this context of folks have had these experience with us, us in our white coats, us in the institutions, we've been, the we that I'm speaking of now is this voice of communities, right? As a frontline community, what it's like to have been studied, and have your, measured, and all of these things, and then to see how the reports that come out, and understanding that how insulting it can be, and when we're talking about the betrayal that's felt when your government, your city, your hospitals, your doctor doesn't really see or understand you beyond whatever statistic or whatever kind of preconceived notion they have about you. And so when we're talking about these communities, I think it's important for us as physicians, medical providers, to understand that what is being called for right now may not be allyship. We need something deeper. We need something that looks a lot more like solidarity, something that cannot be easily withdrawn when we feel a little bit uncomfortable, something that cannot be so easily withdrawn when the going gets tough, because it's real tough. And the reality is, the way that we are looking at things, I don't know if we're actually able to really discern what is actually going on. An example that I'll share, and then I'll open it up for you all, for the rest of the conversation, rather. An example is like just looking at how COVID happened. So many examples about how we looked at communities and, oh, the mistrust, it must have been the Tuskegee. Oh, it must have been the this. These vaccines came out about a year after the beginning of this crisis, and we ignored what that lived reality was. And then we go and say and blame folks for this. Oh, it makes no sense. How could any logical person not trust us? Or even to the fact of the way we talk about these things. When we talk about, oh, the disparities, the inequities that face communities, but then we realize that it actually doesn't serve us for the broader, right? When we see white communities died in droves during COVID. When we look at the sheer number of folks, over 700,000 white Americans died during COVID. And we talk about it as if only Black folks, Latin folks, and everyone else is dying. So how do we switch that and think about solidarity? How do we look at the communities that we're working with as a source of valuable information, not to be extracted from, but to be listened to and to be integrated in our practice? I think the question, for you, like solidarity and what are you looking for when you're looking for partnerships, when you're looking for, relationships with the medical community or others in this work?
Yeah, I'll say for me, I don't think that I ever thought about the distinction between solidarity, allyship, partnership before you said it. But I think that it was implied, but the reality didn't really come to fruition. And I think in the example that, I provided, for us as, environmental justice organizations, when it comes to policy and practice, we really do have an expectation that, when we think about how you reduce people's exposure to pollution, that we are looking for the best solution. And that is not a shared understanding or commitment, maybe. Because people that we sit at tables with are looking for a specific outcome that is funded, that, I've had instances where, and all around this, a national clean energy standard, or how do we reduce emissions nationally? And someone accidentally told me that, larger white-led institutions have been funded to come up with policy solutions 2 years before we ever got to the table. So they were resourced to come up with solutions. They were able to put their best experts and thinking on the table. They had time to actually think. And when you think about what happened in 2020, where COVID, we had the murder of George Floyd, the pandemic was not addressed in a real meaningful way. Environmental justice, frontline communities, public health was front and center. That's the problem that everyone was trying to solve, and we weren't at the table. And when we got invited to the table, it was like, look, we've made a cake. It's in the oven. We did it for you. And it was like, but that's lemon and I like chocolate. And so it's never, that kind of consideration. And that's what I mean about expertise. Like, people are living with, pollution and living with the impacts of being exposed to fossil fuel infrastructure every single day. You have school teachers who can probably talk more effectively and deeply and robustly about particulate matter and, other criteria pollutants than those of us in Washington, D.C., right? We're having intellectual exercises, and people on the ground are having like real life experiences. And so, I don't know how well, yes, I do. I know how we get to that conversation. And when I come into meetings like this and people ask me what it's like, I have very simple answers for you. It's respecting one another's humanity. And there are simple things that show up when you do that. So I'm gonna, pick on my husband a little bit because I value him. When I got an idea and I present it, I get his input, and he might not have the right answer sometimes. So we have to negotiate it. And if he decides like he still doesn't want to do it, then I got to accept the no. And people don't want to take the time to do that. And sometimes I think we feel like the political, cultural cycle doesn't give us the time to do that. And, I don't know how we address that. That's a different meeting for a different set of folks. But I really do, think that I can even bring the difference between allyship, partnership, and solidarity into my conversations. And it probably will be a different kind of interaction.
We were asked to repeat the question, but I forgot what the original question was.
Sorry.
The original question is, what are you looking for in partnerships with the, with the medical community or just partnerships in general? And this question about, allyship versus something that feels deeper.
Absolutely. I understand where allyship comes from, and I'm an ally myself, and I believe in allyship, and I believe in people showing up for others. However, when I said that we have this both and approach and talked about people's immediate needs, but also building a better future together, that's where we look at structures and systems, right? When you look at immediate needs, you're looking at someone who is in distress, maybe because they lost their job, or maybe chronic poverty, or maybe they had an accident. It may be a number of things that are immediate for that particular person. But when you look at systems, now you look at historical injustice, and now you look at historical oppression, when you look at structures, when you look at institutions, and that's the part that we're trying to address as we address the immediate needs of people. And when you start doing that, then you realize that it's not that you're an ally. I'm going to butcher this very famous quote, so apologies in advance, but I'm here because my liberation is interconnected to your liberation, right? And whether I see it or not.
Yeah.
Because, and I think that COVID was a great example, a great event that basically opened people's eyes a lot, because suddenly the people who didn't have access to healthcare, the people who didn't have access to go get a free vaccine or something. No, actually, no, I think everyone did have access to that. But the people who did not have access to sick days, for instance, to go see a doctor, to stay home and rest, potentially could create an issue for people who did have access to healthcare, or people who are in the country with proper legal status, immigration status and whatnot. Guess what? Because the public health, the health of that particular person is connected to my health, right? And so I think that that's something that opened people's eyes to a great deal, but it's true pretty much in everything. Because if you take, for instance, the housing crisis, which is also having a huge impact in public health, the public housing in Miami is no longer a low-income issue. We have people who are middle-class professionals and cannot afford rent. We have people who are moving out of Miami and are still working in Miami because they cannot afford their rent. We have people who have owned their homes for 30, 40 years, and they're being priced out of their homes because they don't have the money. They're on a fixed income, and they don't have the money to fix the roof. Or maybe now the insurance premium is too high, or maybe now property taxes are too high, right? And so it's no longer just like this one particular group of low-income residents, but it's now everybody. And I think that at the core of it, when you look at things systemically and from a historical perspective, at the core of it is greed, corporate greed, right? People ask me, like sometimes you go to a meeting and they have like this question, like everybody answered this question as an introduction. What if you had a magic wand, what would you do? And I say, get money out of politics completely. And that will fix so much, so many issues if you were to get money out of politics, because greed is at the core of so many of the things that we're fighting to correct. And guess what? They're not going to stop at the middle class. They're not going to say, oh, we're not going to go take the homes of middle class people because they're middle class and they're white or whatever. They're going to go after your money. They're gonna go after your property. They're gonna go after your businesses. I think COVID also demonstrated that, a lot of people who were business owners lost their businesses because we had giant tech companies that were basically, gobbling up all the sales and everything was delivered. And we had a huge issue with people basically going out of business because, they could not compete. And they had lost their clientele, or 80% of their clientele, 90% of their clientele. Many of them did not qualify for some of the assistance. At Catalyst Miami, we actually had to tap into a reserve fund to provide a relief fund for people who did not qualify for stimulus checks and other benefits. So I think that looking at systems and looking at structures and looking at issues from a historical perspective will help us realize that we're not merely helping people because they're less fortunate. Yes, we are doing that, but guess what? It's coming our way too.
Yeah.
It's coming our way too. And so the liberation of the people that we're working with is connected to our liberation. And so in that sense, we're not merely allies. We're there because we're in the same fight.
Thank you. Yeah, and I think that what it seems like, and we'll open up for comments in a second. What it seems like we're brushing up against is this kind of fundamental disconnect. I think that when we look at how we're trained in medicine and in science, we're looking for the one answer, the one solution. We're gonna think our way out of things. Usually in our own little lab, in our own little corner, we're gonna find the eureka moment. And I think that when I'm thinking about what is needed, and I think the people who have the most experience about this is the so-called marginalized communities, the people who have been on the receiving end of all of this. The people who know the ins and outs of the systems that don't work for them, the people that know that know that you have to be kind of wary when you see certain words strung together coming from voices of power. And there's something about that knowing. And I think that, again, when we're looking at the communities that we're working with, really looking at what we can get out from, like what we can learn from folks. And I think it is like this fundamental, looking at the values, looking at what brings us to the work, what informs that, and the meaning that we find in this. I think a lot of communities, they come to the table looking for systemic change, looking for something more real than just some outcome at the, some goal that some folks in a boardroom set up. People are really they're working on so many different levels here, and it's such a complex thing, and we kind of look down at this lived experience as if it's not this rich, robust thing that's in conversation and dialogue with generations. With generations of people. When we look at these communities that understand what community is, and they're not just thinking about the next fiscal year. People are thinking, in indigenous knowledge, 7 generations ahead. You want to talk about emergency planning. There's people, these are the cultural practices that we should look at and learn from, not to extract, but to integrate. And to understand that something that's like a part of all of us is accessible to all of us. And so, go ahead.
Yeah, I was gonna say in thinking about or listening to what you just said, I do think every one of you can bring the passion for solving a particular problem to the table. I just think that you have to give up how it comes to fruition. And, I think about like our co-founder and executive director. I was preparing for a federal policy team retreat with my team this week. And research is at the heart of what we do. It's a part of our theory of change. And she is listed as a principal investigator on 37 studies, research papers that have come out of Columbia University because of the very thing you said. How do we change the nature of a university, a medical institution's relationship with community, so it's not extractive, so that we get, and for us, it was the early days of looking at the relationship between asthma and other respiratory conditions and, pollution in the community. And that's it was a very different conversation. It was, we are trying to solve this problem. We are trying to say to the MTA, the Transit Authority in New York, that we are being adversely impacted by having 6 of the 7 bus depots in our community, 4,000 buses every day idling in our community. How do we build the case for that? Which was probably a different problem than what that researcher who knocked on WEAC's door was trying to solve. And I think that that developed into a much larger relationship where we even, forgive me because I don't know the structure of the Children's Environmental Health Department within Columbia University, but we have a seat that is on par to the principal investigator in that center. And so I think you get to it. You just gotta be open to it coming to fruition differently.
Do you have any thoughts?
No, we hear from the audience.
All right, so now we will transition to our Q&A section. If folks have any comments or questions, actually to come to the sides. We'll start with our patient Q&A to the left.
Thank you for an excellent presentation. One of the things that I identify with you is I've been a primary care physician in a sacrifice zone for a long time. One of the things I would tell you is that all of those sacrifice zones exist in the context of the Clean Air Act. How does that happen? It happens from fundamental voids in surveillance and monitoring that are intentional, and the fact that that's not connected to health outcomes.
Yes.
My question as I was listening to you was, what is the level of particulates? No, I can promise you no one's measuring it. That, that's the thing that I've studied the most over the last 10 years that seems to be sadly not going anywhere is how does a sacrifice zone happen, and how do we increase surveillance and connect it to health outcomes? And the bad news is that all of the industries, maybe not so much in New York City, but at least where I live, have fundamentally studied how to exploit loopholes.
Yes.
And that is the problem.
Yeah.
And if
Yes.
we don't study that and continue to study that exposure, we will miss why minority mothers are sicker, not just asthma, but what happens to the placenta, not just from heat, but from the inherent pollution exposure that these mothers are also exposed to. That is cumulative. And it's kind of frustrated me today to listen, not that it's not correct, the effects of heat, but my mind is going on what have those mothers' lungs and what is their placenta sucked into the last several months. And I see on the ground, because I resuscitate those kids, one of my colleagues just this last week, we don't have any normal pregnancies anymore. And it's not even that hot right now. So yeah, that's the thing I would tell you is the policy solution. And we have been on the ground trying to get this changed in Southwest Indiana for 10 years, fighting the introduction of new industry. The problem is that it is intentional, and frequently one of the ground things is the lack of adequate monitoring and the limitations of sensitivity and specificity on pollution monitoring in and of itself. And unless that's addressed, I don't see us succeeding on climate change, and that we need to not forget that frontline communities, in addition to the burden of climate change, have this historical neurodevelopmental and maternal consequences of all that pollution. Thank you.
Thank you.
Yes, all the things. That's the problem that we had with the EPA's proposal. So
Yes.
1,000%. The rule in and of itself allows pollution. Like there should not be an acceptable level of pollution in a community.
If people were actually aware of the limitations of permitting, but I've been trying, yeah.
I just got to tell you. So the problem we had with the rule was that the EPA did not do environmental justice analysis. It did not do cumulative impact analysis, and it was putting a rule out.
Try taking that to a state like Indiana and seeing what could
Taking
go
it
wrong.
to a state. So
No,
what?
I mean, it's worse because not only, they don't even respect the whole purpose of having people safe in the first place. They're literally ungluing it and helping industries fill out permits to accomplish as much as possible.
I know, we have
And
the
when you
one-way
see what
conversation.
that's doing
Yeah.
to the prematurity rate, the stillbirth rate, and you live in a small community, there is no Prozac for that, I guarantee you.
Right. Which
And
goes-
we need more co-op, and there's just inevitably a disconnect between different frontline communities. And some of that, I think, is a problem with organized medicine, but thank you.
Thank you.
Right.
Yeah, thank you. Looks like we have another question.
Yeah.
Comment?
So I was just wondering about your thoughts. You know, we're a year and a half into the Inflation Reduction Act, and the Biden administration has made this commitment to Justice 40 communities, but I think we all think that it's fallen quite short. And so I'm just curious about how your organizations are thinking about how we can do better in terms of the investments flowing to the communities that should be benefiting the most.
Yeah,
You wanna
sure.
start?
sure. Great question. I think when you look at a global crisis and you try to figure out the solutions, you have to also keep in mind that a global crisis is also a great opportunity for making a lot of money, right? And so when you look at the IRA, what you also see in the nonprofit space is you see a lot of, the same old culprits of the climate crisis creating their own foundations, organizing their own tables, energy table and like workforce and, like the tech hubs, you name it, and they're there, right? And they're keeping an eye on everything that nonprofit organizations are doing. So that's one thing to keep in mind, that anything like this is going to attract a lot of people who are going to want to make a lot of money. So that's a reality that we have to deal with. The other thing is that local governments, which are basically at the forefront of the solutions, and nonprofits, even the big nonprofits, we don't have the infrastructure to be able to absorb all that money. We don't have the policy and advocacy capacity. We don't have the grant writing and research capacity. We don't have the organizing capacity. I mean, right now we're working on a climate resilience tech hub. South Florida was designated as a climate resilience tech hub, the only in the country that is focused on climate change or community resilience. We're looking at $40 to $70 million in grants. That's a lot of money. That's a ton of money. And so how do we approach that, working with the county? So they have different criteria. And when you're talking about IRA, you're talking about federal funds. And the advantage of working with federal funding is that it is embedded in the criteria that there has to be an equity component, right? Whereas if you're looking at state funding or you're looking at private funding or you're looking at, public-private partnerships and whatnot, it's not, right? And you have to fight for it. But when it comes to federal funding, at least in theory and in writing, in black and white, it's there, right? So you can work with that. And so they approached us, the county approached us and they said, hey, there needs to be an environmental justice and community engagement component to this. And, we would like Catalyst Miami to help us with that. I said, okay. Gathered up all the organizations that are doing frontline community work and created a criteria, right? And so for the application process has to address, workforce, clean energy, governance, has to address generation of clean energy, clean renewable energy, which for us is, using the waves and the solar and the wind and whatnot. And so what we did was we created a criteria. And we said, okay, what are the things that we need to ensure when we talk about equity? And we're not talking about tokenizing, but we're talking about meaningful community engagement. We're looking at filters or lenses through which we're going to look at the whole thing. And that means governance, for instance. And that means that you need to have community participation when you look at the long-term project through a policy lens. And you're looking at, what are the policies that are going to exacerbate the issue versus the policies that are going to actually change the power structure a little bit and shift some of the power into communities that stand to lose or gain from this particular program. It also means environmental justice. How are we going to ensure that this tech hub is not going to exacerbate environmental justice by creating more pollution in low-income areas, It also means workforce. How are we going to ensure that returning citizens, that single parents, that people who work full-time are able to take these jobs? Well, that means apprenticeships, that means trainings. And guess what? That means childcare. It means dinner. It means interpretation. It means American Sign Language in our particular region, Creole and Spanish interpretation. But it also means, building the capacity for the small businesses. So if we're going to build, a tech hub, how are we going to ensure that local businesses are going to have access to the know-how, the training, the capacity building, and then also the technology, and that they're going to be trained on how to use that technology? We saw a lot of that with COVID, right? Like, contactless technologies, the cash register where there's not a person there. The name for, escapes me right now, checkout, whatever. Cash, yeah, express, cashless, whatever.
Contactless.
With the green light at the top, whatever. How are we going to ensure that the small businesses have that capacity? Not just Whole Foods. You go to Whole Foods and it's like this, like spaceship. You go in and it's like all kinds of lights beeping and like, automated systems and whatnot. What about the grocery store in the neighborhood? And so to us, it means, working with the community members who are at the receiving end of bad policies as we discuss new policies, new programs, new initiatives and whatnot, and then addressing preemptively the issues that we have been seeing historically, and then also adapting to emerging technologies and emerging ways to look at, strategies to solve climate change issues and whatnot. But like I said before, it's every step of the way. You don't wait until you get awarded the $40 to $70 million. You bring community in from day one, and make that type of engagement very meaningful.
I think what I'll add to that is so my office, my team, we work at the federal level. So we did a lot of advocacy around getting line items in the Inflation Reduction Act and the bipartisan infrastructure law that I feel really proud of. But I also feel challenged by there were billions of dollars in fossil fuel technology like CCS and hydrogen that we see like DOE and the EPA actually, incorporating into some of the policies that they put out. I will say, I don't know where my friend in the back went, but like permitting, right? The permitting of projects was addressed in the in the bipartisan infrastructure law in a way that I was so angry that the process was weakened, that I was in a meeting and I was like, we need $500 million to staff up and improve systems and processes around permitting, and got a real easy yes. And I was like, I probably should have asked for twice. But it ended up being like $1 billion in the Inflation Reduction Act for permitting. And so we decided that communities and governments don't know what's in these bills that can improve the conditions for people on the ground. So we launched what we call the Justice Forward Tour. And we went to 8 cities around the country. We did a virtual briefing with Senator Schumer, a virtual briefing with Senator Markey, where we brought people from federal agencies and departments into communities. They sat at tables with local government officials and other community groups for like real-time ideation and problem solving around how some of these resources could be used for energy and workforce transition, for all the plethora of things that are there. And it was concerning. I mean, it was beautiful to have people like standing outside of an airport wanting to build like a solar farm and having somebody from EPA say, yeah, I can give you money for this, and somebody from DOE saying, well, I have some money that can support that. But it also was concerning in that governments aren't ready. Some of these governments don't have anyone whose responsibility it is to follow the money. They don't have someone with the responsibility for applying for these grants. They aren't reaching out to communities because some of them require community and government partnerships. There are legal barriers on the ground. We went to a community outside of Austin that is unincorporated. And the only way they could get a road built was because Tesla built it. The school board is the only entity that can receive federal funds. Systemic structural barriers, right? It is alarming. We have in Washington, D.C., people who don't want to see this money come to communities. So you have senators who are sending letters to frontline groups who might get a grant, asking them to do all of this reporting and accounting for how are they using the money. And they're having to invest in like legal expertise on how to respond to this senator as an intimidation tactic. And we're doing all of this in a political environment that says we got to go now because we don't know if we're going to get a second term. We don't know if this money is going to be reversed. So we can't even move at the speed of trust. We just have to move. And so we're in a really uncomfortable space right now, but still a hopeful, promising space, right? That things can be done, even if small things. So, you know, we, New York, Region 2 for the EPA, we were awarded a TIC-TAC. WEACT was, you know, we brought in expertise on like people who have experience with applying for federal grants and comms folks. And, you know, we had a $6 million grant to raise awareness of these bills. It's a drop in the bucket when you try to go across the country. But I do think that people are doing their part. So it's a mixed bag.
Lovely. We have a few minutes left.
Okay. I have a question about questions, and I know that sounds funny, but we want the discussion to continue. And one of the things you talked to us about today is listening and really meaningfully keeping the engagement up. So what are some questions you wish healthcare or public health professionals asked more, or our groups could, you know, bring home for future discussions?
I think ask us, what problem are we trying to solve? We use data a lot in our work, but I would love to be asked different questions around, you know, how am I trying to apply like data and research and information in terms of like influence and policy. I would, yeah, I think those are my two. Oh, ask us questions related to like really being like intimate with like a location. I think sometimes is missing. We do a whole lot of, you know, national assessments, but if we could really bring that down to communities and use, you know, medical and health information to tell stories there, that would be amazing. And like be able to translate my like weird questions. I know y'all can't get down to like the block, but if you could figure out a way to, oh, this is another thing too. And I'll stop after this. I would really like to see consideration of variables, like come up with a model for how you can like factor in political and cultural kind of I don't know, situations or environments. So if we're talking about, you know, reducing emissions to make it not financially viable for a coal plant to continue, but you're talking about like Wyoming where that's not a consideration. They don't really care about the public health or the economic impacts. They're going to run that coal plant. How do you factor those kinds of things into models? Like, be creative.
I actually, since you answered that question, I want to go back to the IRA question because I think I went off on a tangent and I didn't answer the question. And I think it's really important. So some of the things that we're doing regarding federal funding, Tech Hub, you know, IRA, whatever you know, any federal funding, and all this money that's coming down to the community, in terms of infrastructure, what I meant by that was we are, for instance, right now we're working on a participatory budgeting program, right? And what we're doing with that is we're working with the Office of Management on the budget so that community members learn about the budget process so that they can provide input about priorities, community priorities, prior to the first draft of the budget, so that those priorities are addressed with the money that we have for the county. And that means also working with the Office of Management and the Budget so that there are personnel dedicated to helping people, small businesses and small nonprofits apply for that federal grant money, keep up with all the federal regulations and the requirements and whatnot. It's a maze. It's a labyrinth. It's really, really, really hard to navigate, even if you work in the field. But it also means consolidated planning. A lot of counties do consolidated planning because they have money coming from different directions, and a lot of it can be leveraged and brought together to meet different things collectively. And so we're working with the county also on consolidated planning so that we can help the different departments and agencies that are working on that figure out how to best work with community members in order to ensure that happens. And so that means more capacity for organizing, whether it comes from federal funding or if you're working with the county. I mean, it helps if your mayor actually founded the organization that you work for, which is my case. I know that's not the reality for everyone, but it does help a lot. And then in terms of the questions, I think that I'll go back to Dr. Holder. Being in that community, it's more important. I think being in the heat, in the humidity, because that was right next to the Everglades. And showing up and being there, actually being there, experiencing what community is experiencing and listening to what people have to say. And you won't run out of questions. You'll be asking all the right questions because you'll be there and you will have lived that. You will have been in the reality of the people. And that doesn't mean that you don't ask questions, of course, but having that experience and being in community with community, I think is the best way to go about that.
Thank you. Yeah. I know that we are about at time. Yeah? Okay. Apologies to our online guests. Can we give a round of applause for the folks online and then for our panel today? Thank you. Thank you very much. Yeah, I think in the end, the closing word from me as a physician in this space, working with community-based orgs, having finished the Chef Fellowship, I think the closing space is that the answers to the most serious questions are not unknown to us. They may be in places that we've been trained to or socialized to think where the answers may not be, but these solutions are actually not unknown. If we listen, show up with an open heart and mind, and struggle with and through some of this, also do some of our work that we need to do on ourselves at home, and not rely on the folks experiencing some of this frontline syndrome, that we can actually do this. But what is being called for is something new and different. It's something that's not in our medical textbooks. I think it's something deeper. And I think that a lot of the folks who are leading this work and who have been for generations are the frontline communities. So I hope that we can really respect and really have the compassionate concern that these communities require to really understand, who can teach us and where the rest of the knowledge lies to solve these issues.
And I can't ignore Mark at the microphone. So, and I just, this is your retirement gift, Mark. You get the extra 2 minutes.
Thank you so much. I'm Mark Mitchell. I was previously with the Medical Society Consortium. Did want to let you know that we put together a guide for how health professionals can work with community groups. And in that guide, we have a lot of the questions that you should be asking communities and that you can answer for communities, and talk a little bit about what partnerships, what meaningful and useful and equitable partnerships look like. So that's on the website for the consortium, and so I would recommend that you take a look at that.
And Mark, you are going to be pleased with the next slide. Because first of all, I am so grateful to the panelists for joining us today. When I was emailing them, I was like, they're just doing such important and powerful work. And I was like, felt like asking them to join us was like a lot because they're doing so much. And I'm just so grateful that you came here. And I know that, the work that you're doing, it's never a slow season in DC, but especially not now and what's happening in Miami. Like, I just really I'm grateful to y'all for coming here, and it's not a small thing.
Thank you.
And yeah, we need a new way. We clearly need new ways because the ways that we're moving through the world aren't working so well.
Amen.
And a great step is that about a month from now, we'll dive deeper into what we discussed here. How do we move forward and do this? Let's figure this out together. Let's have some harder conversations about, what this actually looks like and how we do it better. So there's a QR code here you can scan and sign up right now. Please do that, and then it'll be dropped in the chat. So more to come, and just really, really grateful to y'all.